I don't think these folks need any introduction, but Susan DeVore is the president and CEO of Premier. Glenn Steele, as you know, is the president and CEO of Geisinger Health Systems. And Mark Eustace is the president and CEO of Fairview Health Systems. They're each going to speak for a few minutes about their organization and a little bit about delivery system reform. And then we're going to take questions from myself and from the audience. So please think of some things you'd like to say. So in the interest of that, we're going to get started, and Susan's going to start for us.
Thanks, Julie. I don't know how many of you know Premier, but Premier is a performance improvement alliance. We have about 2,300 hospitals across the country and about 66,000 or so non-acute care sites. And we're really dedicated to driving through collaboration and data and information this transformation of healthcare quality and cost effectiveness. I'd like to spend my first, several minutes talking about what I think are the intended consequences of reform and maybe some of the unintended consequences of reform and how our alliance is working to innovate from the inside. Firstly, I think that the reform legislation, while built in sort of the halls of Congress, the real test is going to be the execution in the delivery of care. And I think in some ways it's a declaration by the public or the consumer that they might not want government making their clinical and economic decisions. They might not be too excited for insurance companies by themselves to be making clinical and economic decisions. What they really want is a way for patients with their providers in their communities to help them make the clinical and economic decisions. And I think the health reform proposal starts to build, or legislation I guess now, not proposal, starts to build a framework. And the framework is general in some ways and it's very specific in other ways. But I think for individuals, the mandate to have insurance brings accountability with it. I think for insurance companies, the legislation around pre-existing conditions and the attempted control at medical costs and administrative costs brings accountability to insurance companies. I think employers have the accountability of providing for their employees. I think doctors have accountability for measuring quality, safety, and outcomes and working on cost. I think hospitals and health systems have the same cost, quality, overall improvement in the health of their communities accountability. So I think that the legislation goes pretty far in terms of setting a framework of accountability. And I think for hospitals and health systems, what that means is lots of transparency. It means that they basically need to count on not being paid for anything that's preventable.